and welcome to today's episode of Let's Talk About Health. I'm your host, Madeline Mant, and today I'm absolutely delighted to introduce our guest, Vanessa Yeboah, who is here to tell us all about her work as a nurse practitioner. So welcome to the show, Vanessa.
Thank you for having me.
So Vanessa, I want to dive right in because I'm just so excited to talk with you today. What is a nurse practitioner?
So a nurse practitioner is a registered nurse with advanced practice. I screen health conditions. I order labs and tests to help discern what diagnosis an individual may have. I treat and I manage both medical and mental health conditions as well as addictions.
So can you tell me a little bit more, how does a nurse practitioner differ from just a registered nurse or a public health nurse?
Okay, so the difference really is academically as well as scope of practice and skill set. So academically, a RN has done a degree in Bachelor's of Nursing or a Bachelor's of Science in Nursing. They follow the orders which a nurse practitioner or a medical physician provides. They also carry out tasks like activities of daily living with clients. They administer medications, perform treatments in like wound care, for instance, and monitor disease and convey the concerns that they may have about a client to the physician or nurse practitioner.
Okay.
And where a nurse practitioner has an additional postgraduate degree in nursing or something nursing related. So for instance, I actually have a master's of public health, and then I went back to school and I did a certification in the nurse practitioner. So this allows me to monitor health a little bit more closely with my advanced knowledge and prescribe, for instance, order and interpret labs, as well as consult, refer clients to other specialties. And sometimes you can perform specific procedures and then treat with medication or alternative therapies.
Wow, this is a huge scope of practice. This is really interesting. Now, you mentioned just briefly there that you work with some mental health and addictions. Can you tell me a little bit more about kind of how you got into that area? Because I'm really interested in where we might find nurses. It's not just a hospital, right?
No, so technically I do work at a mental health hospital.
Okay.
But within healthcare itself, there are definitely different avenues that a nurse can take. So there could be the public health setting. There can be, like a primary care clinic where you might go for like, your first interaction in terms if you have a mental health or a medical concern. And then in my setting, it is considered a tertiary setting. So often patients are referred there for their mental health or addiction concerns.
Right.
And then while they're there, I do focus on providing primary care.
Okay. Well, this is super fascinating. And so I want to bring it, I want to talk about your public health background too in a moment, but what we're doing this for, of course, is an anthropology class. And in our anthropology, we're talking a lot about how we use language and how we talk about concerns about health and illness. And so how do you in your work use and conceive of words like health and illness and wellness and sickness?
Yeah. So, well, health encompasses like mental health, physical health, and social well-being. So I definitely like incorporate these terms in conversations with clients to help identify what their care needs are. And so, often it's the client who's self-identifying what they consider their illness or, societal views on sickness. And then they come and seek, help trying to find out more information and how to kind of move along within the spectrum that we call health. So, while working with clients, they might identify going through withdrawal symptoms if they're going through substance withdrawal. Like, so for instance, let's talk about alcohol, for instance. So, I might manage their alcohol withdrawal and they might report like, cessation of those symptoms. But the reality is sometimes is that, they might have been drinking chronically for several years and they might have damaged their liver. So they might still have a diagnosis like cirrhosis. And now we focus more on, the progression of the disease. We want to limit that. We want to also focus on quality of life. So really focusing on the balance between healthy lifestyle, healthy living, mental health as well, and spiritual care as well.
Yeah. This sounds like really important and really meaningful work. And so I'm hoping that maybe some of the students that are watching this video are inspired by your journey and want to take on the task of becoming a nurse practitioner themselves. So it sounded like there was a lot of school involved in this. Can you tell me a little bit about how a student might actually pursue this pathway?
So again, they would have to become at least a registered nurse at first. So that involves a degree in the science of nursing or in nursing. And they must work a minimum of 2 years of full-time work. And then after that, they can apply to the graduate program. And so the typical route most people take is kind of a master's in nursing and the certification. And that's typically a 2-year program if it's done full time, but obviously they can pursue part-time as well. And alternatively for myself, what I actually did is I did a master's in public health, because you can also do something in a health discipline as well. And so then I went back and I did the certification. And that's where you really learn about those advanced practice skills in terms of assessments and therapeutic management of medical and mental health conditions.
That's fantastic. Well, Vanessa, thank you so much for your time today, sharing your expertise with us. And thank you also to our audience, as always, for joining us. And we will both see you next time on Let's Talk About Health.
Thanks for having me.